Good afternoon, everyone. Welcome back to the another session of Cancer Care at American Oncology Institution. Today, we are here with Dr. Sujit, consultant radiation oncologist at AOI Coimbatore. Dr. Sujit completed MBBS from Stanley Medical College, Chennai, and he completed DMRT from Madras Medical College, Chennai. He trained under DNB program for 2 years at GKN Hospital, Coimbatore. He has an overall 21 years of experience in radiation oncology, and today we are going to discuss about screening for cancer. Sir, over to you, doctor.
Good evening. Today I am going to talk about screening for cancers. What is screening? Screening is testing for the presence of cancer in healthy persons. Why is screening important? This is very important because screening helps us to diagnose cancers at an early stage which may be growing in your body even without your knowledge. Sometimes we are able to detect even precancerous lesions, that is, the changes which happen in the tissues before frank cancer develops. So when we are able to catch these precancerous lesions, we are able to prevent the cancer from developing, and thereby we are able to cure you. What are the cancers where screening is useful? So there are few cancers where screening makes a very big difference in the management of cancer. Of these, head and neck cancers, breast cancer, and cervical cancer are the three most common cancers where screening is very useful and makes a big difference in the lives of our patients. Why are these sites easy to screen? It's because of accessibility to examination. The oral cavity, the breast, and the cervix are easy to examine, and simple tests can be done to detect precancerous lesions or early stage cancer. It is all done on an outpatient basis, and it is generally painless and easily done. We'll start off with head and neck cancers. Head and neck cancers form a big chunk of the cancers that we see in our regular practice. Head and neck cancers are twice as more common in men as in women. The biggest risk factors for head and neck cancers are tobacco and alcohol. Some viruses also contribute to head and neck cancers. So what are the sites where we get head and neck cancers commonly? The most common sites where we get head and neck cancers are the lips, the oral cavity including the lips, the tongue, the cheeks, the back of the throat, the vocal cords, and so on. It is easy to examine the oral cavity and detect precancerous lesions. So what do precancerous lesions look like? There are a few lesions which can be termed precancerous. Of these, leukoplakia. Leukoplakia is a whitish lesion that is seen on the surface mucosa of the oral cavity. Erythroplakia. This is a reddish colored flat lesion that is again seen in the oral mucosa. What do cancers of the oral cavity look like? Any ulcer or any growth or any swelling noted in the oral cavity on the tongue, the cheek, the floor of the mouth, the soft palate, the tonsils, and the walls of the throat. Any of these could be a cancer. Generally, cancers are painless to start with. So it is easy to get fooled thinking it is nothing, while it is hiding a disaster waiting to happen. So how does one get oneself screened for an oral cavity cancer? Or rather, before that, who are the persons who should get themselves screened for an oral cavity cancer? As I said, tobacco and alcohol are the very prime risk factors for oral cavity cancers. So smokers It may be anything, cigarette, BD, hookah, or anything. Any form of tobacco. If someone uses tobacco, then that person is at risk for oral cavity cancer. Any person who drinks alcohol regularly is again at risk for oral cavity cancers. So age is not a criteria. If you are a young person who regularly consumes alcohol, who regularly smokes tobacco, then you are at risk for oral cavity cancers. Who do you approach to get yourself screened? For oral cavity cancers, the best persons to get yourself screened are a dental surgeon or an ENT surgeon. So, when you go to the dental surgeon or an ENT surgeon, what does he do? The surgeon shines a light inside your oral cavity, that is inside your mouth, and looks for telltale signs of early cancer or precancerous changes like ulcers, swellings, lumps, growths, or flat lesions like erythroplakia and leukoplakia. He also does a scrape test for the presence of a virus called a HPV virus, a human papilloma virus, which is responsible for some of the oropharyngeal cancers. It is a painless test and is completed within a few seconds.
Thank you, sir, for telling us about head and neck cancer. Could you please tell us about the early signs and symptoms of breast cancer?
Breast cancer has been growing at an alarmingly increasing rate in our country. It is basically a lifestyle-related disease. The early symptoms of breast cancer are unnoticeable, which makes it all the more important that all women should get themselves screened appropriately for breast cancer. Early breast cancer usually presents itself as a lump, a very small lump, which is usually painless. Sometimes it may occur quite close to the nipple, and at that time it may cause nipple discharge or pain. Very rarely does early breast cancer cause any ulceration of the skin. So generally it is very small to start with and unnoticeable to the general population. So what do we do when we screen for breast cancer? When we screen for breast cancer, we try to pick up the small lesions which cannot be seen or sometimes which cannot even be felt by hand. We use special X-rays called mammography, which can detect very small lesions, even 5 millimeters size or less. Nowadays, we use MRI scans to detect even smaller lesions, which the patient wouldn't even think that they have. At home, ladies can test themselves using the breast self-examination technique, which is nothing but palpating your own breasts with the palm of your hand. So the palm of the hand is used to compress the breast and gradually rotate in rotatory fashion. It is checked for any lumps or any hard swellings. If any hard swelling or lump is noticed, then it has to be immediately brought to the attention of your family doctor. Breast self-examination is an easy procedure. It can be done at home and should be done at least once a week by all ladies who are 30 years or above age.
Thank you, sir. Could you please tell us about who is the suitable candidate to get themselves screened for breast cancer?
Generally, screening for breast cancer starts at the age of 40 years. But all women should have a risk assessment done at the age of 30. What is risk assessment? This categorizes the general population of ladies into persons who are at higher risk of developing breast cancer and those who are at normal risk. The category of ladies who come under high risk are those who have a family history of breast cancer, especially in first degree relatives, those who have had an early menarche, that is, those whose periods started early, those who are at risk for developing breast cancer due to any previous radiation treatments to the breast or chest area. Generally, the cancer screening that starts at 40 years starts off with a mammography. This is a special X-ray that compresses the breast tissue and takes an X-ray, and which can detect lesions as small as less than 5 millimeter size. Sometimes this is also used in conjunction with an ultrasound to gain more insight into the type of the lesion. Nowadays, even MRI is used to detect lesions which are not seen even on mammography.
How frequently should women get screening for themselves?
After the age of 40 years, women who are at high risk of breast cancer should get themselves screened at least once a year, and this includes at least a mammography.
Sir, cervical cancer is one of the commonest cancer among the women in India. Could you please tell about the early symptoms of cervical cancer?
Yes, cervical cancer is one of the commonest cancers in India. Unfortunately, the symptoms of early cervical cancer are almost nil. Generally, patients present to us when they have stage 2 or stage 3 or sometimes even stage 4 cervical cancer. Stage 1 cervical cancer usually has very few symptoms, and some of them include a whitish discharge which may at times may be purulent. Very occasionally or very rarely there may be bleeding in stage 1 cervical cancer.
Sir, what is the appropriate age to get screening for cervical cancer?
All women who are above 21 years of age should get themselves screened for cervical cancer. Women who are between the ages of 21 to 29 only need to get a pap smear. A pap smear is a very simple test done by the gynecologist as an outpatient procedure. Here, a very small ice cream stick like brush is used to scrape the cells from your cervix, and which is examined under microscope for potential development of cancer. So this is a very simple step which can save lives. From the ages of 30 years to 65 years, women should get two kinds of tests. One is the pap smear, and the second is the test for the presence of the HPV virus, the human papilloma virus, which is responsible for more than 85 to 90% of all cancers, cervical cancer cases. So this test, it detects the presence of the viral DNA in the cervical tissues. Because the HPV virus or the human papilloma virus is a causative organism for most of the cervical cancers, there is a vaccine which has been developed to prevent the development of these cervical cancers.
Sir, could you please tell us more about the vaccines for cervical cancer?
Yes. Vaccines for cervical cancer have been available at least for the past 2 decades. The earlier vaccines were bivalent vaccines, which means they were active against only 2 types of the HPV virus. Quadrivalent vaccines were developed, which were active against 4 variants of the HPV virus. Now, there is a nonavalent vaccine available, which is active against 9 varieties of the virus, which cause not only cervical cancer, but cancers of the oropharyngeal, the throat region also. And in addition, they cause certain genital warts also. So with the nonavalent vaccine, we can protect ourselves against all of these diseases. The ideal age to get vaccinated is girls between the ages of 9 to 12 years. This is the ideal time for them to get vaccinated, because trials have shown that the results are doubly better when compared to given later in life. So all females between the ages of 9 to 12 are eligible for cervical cancer vaccination. This cervical cancer vaccination can be given till the age of 26 years for females. Beyond the age of 27 years up to the age of 45 years, cervical cancer vaccine should be used only for females who are HPV negative, because it doesn't work in persons who are HPV positive. The cervical cancer vaccine gives protection against the majority of the viruses causing cervical cancer. Recently, the government of India has launched an Indian-made cervical cancer vaccine, and it is to be included in the routine immunization program for children. Thank you.
Thank you, sir. Thank you, viewers, for watching the live session. Stay tuned and please subscribe to our channels. If you have more queries, please reach out to us through Messenger or post them in the comment section. Thank you, doctor. Thank you all.
Thank you.
Thank you.